What would happen if I told you that one of the most effective ways to reduce the risk of prostate cancer lies in the very act of ejaculating every day? It may sound counterintuitive because around us there are many conflicting beliefs. Some people claim that one must retain semen to preserve vital energy, while others believe that regular release is the way to maintain good health. So, what is the truth? And where is the line between myth and scientifically proven fact? Hello, everyone. I am Dr. Naren with 7 years of experience in andrology. And in today's video, we will not follow hearsay. We will look directly at the truth through the perspective of modern medicine to provide a clear answer to the question of what really happens if you ejaculate every day. I will explain in detail 5 unexpected benefits that this action may bring to your health and outline 5 potential risks that you must recognize to avoid harm outweighing benefit. My goal is not to impose a rigid rule, but to provide you with knowledge so you no longer feel confused among contradictory information and can confidently take control of your health and your own sexual capability, whether you are in your 30s, 50s, or even 70s. I also want to hear from you. What worries you the most when you think about this issue? Is it long-term health, short-term performance, or something else? Leave a comment below, because every one of your contributions helps build a more informed and confident male community. Do not forget to like and subscribe, because this is where we will have honest and valuable conversations like this every week. Now let us begin by clarifying one of the biggest misconceptions. The biggest misconception is equating ejaculation with depletion. In reality, from a scientific perspective, our body considers this a natural physiological process with its own self-regulating mechanisms. When practiced in a healthy manner, it can provide benefits that you may have never expected. The first benefit, and also the most important one, is the reduction of prostate cancer risk. This is not an empty statement. A large-scale study from Harvard University that followed more than 30,000 men for nearly 20 years discovered a remarkable finding. Men who ejaculated 21 times or more per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times. Why does this happen? The most widely accepted hypothesis is the cleansing mechanism. Each ejaculation functions like a natural flushing process for the prostate, helping to expel old cells, inflammatory agents, and potentially carcinogenic substances that have accumulated over time. Biologically, this is a natural detoxification process. Psychologically, it provides reassurance regarding one of the greatest health-related fears among men. Practically, it indicates that moderate sexual activity may play a role in protecting your own health, although it cannot replace regular medical checkups. The second benefit is a natural sedative for better sleep. You may have noticed that you feel more relaxed and sleepy after reaching climax. This is not due to fatigue, but because of science. During ejaculation, the brain releases a hormone called prolactin, which promotes relaxation and induces sleep. Combined with endorphins and oxytocin, which reduce stress, you essentially have a natural sleep aid without side effects. For men who frequently struggle with sleeplessness due to work stress or simply difficulty falling asleep, this can be an extremely effective solution. It helps you fall asleep faster, sleep more deeply, and as a result, wake up the next day with clearer cognition and renewed energy. But did you know that sexual activity does not only relieve the body, but also functions as a natural stress reliever, more effective than many methods you may have tried before? In the next section, we will explore how it resets your brain. The third benefit is mood regulation and stress relief. The feeling of satisfaction after ejaculation is not merely a sensation. It is the result of a chemical reaction in the brain. A cascade of feel-good hormones is released, including endorphins, which are the body's natural painkillers, dopamine, which generates reward and motivation, oxytocin, which fosters bonding and trust, and serotonin, which stabilizes mood. Their simultaneous release helps recalibrate your nervous system, reduce anxiety, dissipate negative emotions, and strengthen emotional resilience. Practically speaking, this means you will be less likely to become irritable with loved ones, less prone to suppress stress, and better able to cope with daily pressures. It functions like a natural reset button for your mind each day. We have discussed prostate health, sleep, and mental well-being. However, the benefits do not stop there. They also directly influence the core operating systems of your body. The fourth benefit is a mini workout for the cardiovascular system. Many people worry that sexual activity may strain the heart, but the truth is often the opposite. When the body is stimulated, it undergoes a full-body response. Your heart rate increases and your blood vessels dilate to enhance circulation throughout the body. This vascular dilation, also known as vasodilation, helps deliver oxygen and nutrients to your muscles, your brain, and even your skin. Biologically, it functions like a short but effective training session for the vascular system, helping it maintain elasticity and responsiveness. Psychologically, improved circulation directly enhances the quality of erections, which strengthens confidence and male sexual capability. Practically, it serves as a natural way to support cardiovascular health, an aspect often overlooked when discussing sexual health. The fifth benefit is something that may surprise you, which is immune support. This is an unexpected bonus for most people. Studies have shown that arousal and orgasm can increase levels of the antibody IgA, which is one of the body's first lines of defense against invading viruses and bacteria. Combine this with the reduction of the stress hormone cortisol, which we know can weaken the immune system, and you have a subtle but very real enhancement of your overall immunity. Biologically, this represents a stronger protective shield. Psychologically, it brings a sense of reassurance, especially as we become increasingly mindful about safeguarding our health against illness. Practically, it reinforces the fact that sexual health is not separate, but is an essential part of overall wellness. We have now clearly seen 5 scientifically supported benefits from protecting the prostate, improving sleep, reducing stress and enhancing cardiovascular health, to supporting the immune system. At this point, many people may think that there is no reason to hesitate. However, if we only focus on these benefits, we are seeing only half of the picture. The other half, which is the darker side, consists of the potential risks that appear when this action shifts from a healthy habit to an unconscious compulsion. How can we distinguish that fragile boundary, and when does this natural supplement turn into a double-edged sword? However, we need to be honest with each other. Everything has 2 sides, and ejaculating every day is not always beneficial. For some individuals, it can backfire in harmful ways. These are the 5 major risks. The first drawback is that it can turn into a compulsive behavior. This is an extremely fragile boundary. There is a significant difference between a healthy habit and a pathological urge. If you consciously choose daily ejaculation to relieve stress, find pleasure, or strengthen intimacy with your partner, that is one situation. But if you feel controlled by that urge, if it begins to interfere with work, distract your focus, or distance you from real-life relationships, then it is sliding into the dangerous territory of compulsion. Biologically, repetitive behaviors can reinforce pathways in the brain's reward system, making you increasingly dependent on them to experience satisfaction. Psychologically, it creates a cycle of guilt and shame. Practically, it consumes time, attention, and even the possibility of genuine intimacy with your partner. Ask yourself honestly whether you are choosing to do this or being controlled by it. The second drawback is using it as an emotional crutch. All of us face stress, boredom, loneliness, or disappointment. These are natural parts of life. But if ejaculation becomes your only tool for coping with negative emotions, it may be masking deeper, unmet emotional needs. Biologically, it reinforces reliance on a single pathway for comfort. Psychologically, it prevents true healing from the root of the problem. Practically, it keeps men from developing healthier outlets such as exercise, writing, talking with friends, or seeking professional support. Remember, ejaculation should be one tool in your toolbox, not the only one. The third drawback is reduced sperm count. If you are trying to conceive, this may not be a concern for everyone, but medically, it is an important fact. If you and your partner are trying to have a child, daily ejaculation may reduce sperm concentration in each ejaculate. Biologically, sperm requires time, usually between 48 and 72 hours, to regenerate and reach optimal levels. Psychologically, this may unintentionally add stress and pressure for couples experiencing fertility challenges. Practically, a simple strategy is to space ejaculation to every 2 or 3 days during conception periods, which may improve the chances of success. This is not abstinence, but a strategic approach. However, more concerning than its effect on fertility is when it begins to erode your own sensation and confidence in the bedroom. That is when truly alarming problems start to appear. The fourth drawback is a paradoxical and ironic one, which is reduced sensitivity and libido. The paradox is that the more you do it, the less you feel. Overusing something beneficial can desensitize your reward system. When ejaculation occurs every day, especially when it is done hastily, repetitively, and without emotional connection, it can decrease physical sensitivity and suppress natural desire. Biologically, your brain adapts. It begins to respond less sharply to dopamine, which is the chemical that generates pleasure. The dopamine surge is no longer as strong as before. Psychologically, it can create a sense of emptiness or indifference. Sexual activity no longer feels like a passionate desire, but becomes a mechanical habit. Practically, you may notice that you are less aroused when you are with your partner and the spark seems to fade. Sometimes short breaks of a few days can help reset sensitivity and reignite desire. The fifth drawback is the direct consequence of haste, which is performance issues. If your daily ejaculation occurs through quick, intense, and rushed stimulation to reach the goal, you are unintentionally training your body to become accustomed to speed. Over time, this can condition the nervous system to respond too quickly, leading to premature ejaculation or anxiety about endurance when you are with your partner. Biologically, your nervous system has become accustomed to sprinting instead of running a marathon. Psychologically, it creates frustration and feelings of inadequacy for both partners. Practically, it erodes your confidence exactly where you need it most. The solution is to slow down. Focus on the process and the sensations rather than only the destination. Retrain your body to understand rhythm and control instead of mere release. So, what is the final conclusion? After examining both sides of the issue, it is clear that daily ejaculation is not inherently good or bad. It becomes beneficial or harmful depending on you. The key lies in asking yourself why you are doing it. Is it for pleasure, connection, or is it driven by an uncontrollable urge? How does it affect you? Are you sleeping better and feeling more confident? Or are you feeling tired, indifferent, and guilty? Does it align with your goals? If you are trying to conceive, do you need to adjust the frequency? Listen to your body. Observe your energy, your mood, and your desire. Do not hesitate to experiment. Try daily frequency, then try spacing it out. See what makes you feel your best. And remember that sexual health is a part of overall health. Never ignore changes in erection, quality, pain, or urinary symptoms. These are signs that your body needs medical attention. No matter your age, whether 30, 50, or 70, your body can still adapt. Your health can still improve, and your confidence can continue to grow. Keep learning and keep listening to your body. I am Dr. Naren. Thank you for spending your time with me. If you found this video helpful, give it a like, subscribe for more content about men's health each week, and share your thoughts in the comments. Today, are you controlling your habit or is your habit controlling you?